Hello everyone. So in this wave, many children have already been infected with COVID, and today I will be answering the commonly asked questions that parents are asking me regarding the post-COVID care of children. The first question which I commonly get is, when can I take my child outdoors? When can he or she go down to play? So basically 7 days after the child tests positive, your child can end the isolation provided the child has been symptom free for the last 3 days. So if that is the case, you can send your child outdoors to play, but still make sure your child is masked up and takes adequate precautions with other children. The second question which I'm hearing is about the diet. Are there any specific precautions we need to take regarding diet? Any special diet which needs to be given? Any special multivitamins that should be given? So you just have to give a regular balanced diet, which I always tell. Fruits should be there in the diet, vegetables, a good quality protein like dal, egg, rajma, chicken, chole, chanas, all these things should be there in the diet. Some dry fruits you should give the children, and regular around 400 to 500 ml of dairy intake. Younger kids, little less dairy intake is also fine, and good amount of water. If the child had a bit of a throat irritation during COVID or severe throat pain, sometimes that irritation may linger on for another 1 or 2 weeks. In that case, you can give more of warm liquids like soups, warm dal, some warm milk with turmeric or honey. You can give all those things, but otherwise there is no special diet. Avoid giving outside food. That anyways I recommend, but especially post COVID for a week or two, avoid giving outside food because they may get some loose motion, some vomitings, and that may complicate the picture. There is no need of any special extra multivitamins. Vitamin C, it has now been proven they really don't help. It's up to you. See, taking a multivitamin is not a big deal. If you want to give for a week or two, fine, you can give. But typically in any illness, any viral, child will not eat well for say around 5 to 6 days. So after that, the child will start eating and will make up for that 5 to 6 days of not eating well. But if you feel your child is still being very fussy, has a very low appetite, okay, go ahead and give a multivitamin. Special vitamin C not required. You can just give some lemonade, vitamin C rich fruits, but there is no proven role of any multivitamin. Third question which I get is about vitamin D. So many parents want to give vitamin D during COVID or post COVID to boost the immunity. Now vitamin D is important like that also. So if your child has not been exposed to outdoors, you keep your child mostly indoors, or there is not much play time when the sun is out, then vitamin D can be given in discussion with your pediatrician irrespective of the COVID status. So there's no special link with COVID. So if you feel that is the case, please go ahead and consult your pediatrician for vitamin D supplements. Does the child need extra rest post-COVID? Should I allow her or him to run around too much? Absolutely no. Children can go about their normal activities. In fact, I see children after 2 to 3 days of fever, they are running all over the house and they will not be confined. Unless your child had some sort of COVID pneumonia or some COVID complication for which she had to be hospitalized. In that case, I would recommend you discuss these things with your pediatrician once, but otherwise no restriction in physical activity and diet at all. Now, what to watch out for post-COVID? Now, there is one thing which I want all parents to be aware about. This is not common, this is very rare. This is multi-system inflammatory syndrome in children. You must have heard about it. So, this is a post-COVID complication in children. So, in children, COVID rarely causes any severe illness, but this what I'm talking about, multi-system inflammatory syndrome, can be significantly severe in rare cases. So what and how to watch out for it? If after COVID, within 2 to 6 weeks post COVID, this can happen. If your child has a high grade fever which is not going down within 48 hours, associated with some other system involvement. So as I said, multi-system, so some loose motions, abdomen pain, rashes, vomitings, giddiness, feeling of confusion, feeling that the heart is beating very fast, feeling of significant lethargy, red swollen lips, lymph nodes around the neck. Any doubt, please consult your pediatrician, because this MIS-C or multi-system inflammatory syndrome, if picked up early, the treatment is simple. Within 2-3 days of admission and giving the relevant medications, the child will improve. But if the diagnosis gets delayed, unfortunately, it can lead to severe involvement of the systems, which could be kidney, heart, liver, gastrointestinal system, neurological system. So it's very rare. I'm not trying to scare any of you out there, but you need to be aware about it. So otherwise, COVID is being mild in children. Children are getting better within 3 to 5 days, and there is no any extra special care required.